Hello again. Pain management isn't always just about medications. Today I want to share 3 hard lessons from my experience that doesn't have much to do with the knowledge base on pain medications. These insights can save you time, help build more trust with your patients, and lead to better patient outcomes. If you've been in this field for years, you'll likely resonate with these experiences. And for those just starting their pain management journey, you'll encounter these lessons, so don't get discouraged. Watch till the end because the lessons I've learned can make a significant difference in your practice. Remember, we're all in this learning journey together. This is a recent hospice case I had. The patient said the medications didn't work, and there I was thinking, alright, now what? Does this ring a bell? If it does, stay till the very end. You'll learn how to handle these situations more effectively, build stronger patient trust, and improve outcomes. So lesson number 1 is to set clear expectations. In other words, we need to answer the core question, what are we trying to achieve? In this particular case, the issue started when the patient mentioned that the opioid didn't work. As it turns out, when the patient first arrived at the hospital, he received a Dilaudid shot. This became the reference point for how he perceived pain relief should work. Regardless of what opioid regimen I tried, the result was the same. It did not work. Here are the problems I wish I had caught earlier. First, I should have explained that IV opioid could be much more potent than oral medications. Second, I could have clarified expectations sooner. So, a big takeaway here is, don't assume patients know what to expect. It might be their first time ever receiving any pain medications. Second, don't assume what we want is what patient wants. If you're watching this video up to this point, I know you care about your patients. So let me ask you this. When was the last time you explained a numeric pain score to your patient when ordering a pain medication? Comment below and be honest. Lesson number 2 is to ask the right questions. This takes a lot of practice. Let's take the statement, "it did not work," as an example. If we hear that and immediately start considering the next steps, we might make the wrong clinical decision because we don't have the entire context of what that statement means. Here are some follow-up questions to consider. How did it not work? What's considered working for you? Did it not work at all or only at certain times? By asking the right questions, you can get to the core of the problem, which will help you decide the next best move. I know every time we do the first interview, it can almost sound like an interrogation. So make sure you let your patient know this ahead of time. Tell them, I'm here to help. The more I understand, the better I can help. Lastly, this is a lesson from the first 2 combined. Take your time. I constantly remind myself to take my time to see the big picture, identify red flags, and pick out the details. Doing things right the first time is much more important than making hasty decisions and then going back to fix them. It wastes time, and the patient is often in distress and making it hard to build rapport. Going back to fix things just make things even harder and really affect the outcome. This is all I want to share today. If you learned something and start applying these lessons to your next encounter, comment below and let me know how it went. Don't forget to like and subscribe. See you next time.